you, because I think DC, to talk a little bit about the request for proposals process.
Hi, Natea. Thanks, Natea. Hi, everyone. Thank you so much for joining. My name is Erica Zissis, and I'm a Program Operations Associate with the Being Initiative at Grand Challenges Canada. For the next 10 minutes or so, I'm going to be providing a very brief overview of the requests for proposals and the available funding opportunities we have open right now under the Being Initiative. Next slide, please. So before I begin, I just want to share a few quick notes and reminders. When the RFP first launched in April of last year, we did host a full applicant webinar, which goes into much more detail about the RFP and includes a question and answer period. So this can be found on our website. Please feel free to review that as well, but just note that some of the information may be a bit outdated, and in this shorter presentation, we're going to aim to highlight those key changes. I also want to highlight that this webinar and the previous webinar are not meant to replace a review of the full request for proposals or FAQ, frequently asked questions document. Both of these documents contain really rich and detailed information about the funding opportunities, how to apply, the evaluation criteria, and the review process. So we kindly ask that you read these documents carefully before reaching out to any of the Being partners with questions about the RFP. For access to all RFP documents, you can visit our website, beinginitiative.org/opportunities. Next slide. So what is Being? Being is a global mental health initiative that envisions a world where young people feel well and thrive. Being's mission is to work in partnership with young people to improve their mental health and well-being. And to do this, we fund and support research, innovation, advocacy, and ecosystem building with a focus on prevention and promotion. Being was launched in response to the ongoing mental health challenges faced by young people in low and middle income countries. Next slide. Being is the product of a collaborative partnership between Grand Challenges Canada, Fondation Botner, the Science for Africa Foundation, and United for Global Mental Health, and we work alongside support from the United Kingdom's Department of Health and Social Care and Global Affairs Canada. Orygen is Being's learning and support platform, and they provide technical support to funded projects. Grand Challenges Canada is the host of the Being Initiative, and we manage the operations and implementation. Next slide. So through the innovation pillar of the Being Initiative, we launched a request for proposals in April of 2024, looking to fund bold prevention and promotion ideas that address the early drivers of mental health and well-being for the most underserved 10 to 24-year-olds in 12 priority countries. Through the RFP, we're funding proof of concept and transition to scale innovations that meet the context-specific upstream drivers of young people's mental health and well-being. And although this third opportunity is no longer open, we're also going to be funding ecosystem level efforts within each country that aim to address systemic barriers that hinder the integration and sustainable scaling of mental health innovations. Taken together, we're hoping to build both a strong pipeline of innovations and a mental health ecosystem that can support these innovations to scale. However, for the rest of this short presentation, I'm going to be focusing on the two funding opportunities that are still available, proof of concept and transition to scale. Next slide. Through proof of concept or POC, we're looking to fund early stage innovations to test and refine bold ideas. POC grants are awarded for up to 250,000 Canadian dollars over the period of 15 to 24 months. Through Transition to Scale, or TTS, we're looking to fund tested innovations that are ready to scale. And these TTS grants are awarded between 300,000 and 1.5 million Canadian dollars over a period of 12 to 48 months. And this amount and duration will depend on where a project is at in its scaling journey. Both POC and TTS innovations should target underserved youth aged 10 to 24, be implementing in one of Being's 12 priority countries, and be aligned with the country priorities outlined within the RFP. Next slide. So can you go back one? Sorry. Oh, sorry. I think one of my slides is missing. Anyways, I was just gonna say that each of the 12 countries has a unique funding priority, which was determined through a year-long locally led landscape analysis process to surface the primary drivers of youth mental health and well-being in that context. So when we say that innovations must align with the country priorities identified in Appendix A, we've got 12 countries, and each of the focus areas looks a little bit different within each of these countries. Some are focused on youth mental health in school environments, others are focused on strengthening family relationships. But we've pulled the context from these landscape analyses and the funding priorities into the RFP. So we would strongly encourage you to review these carefully before preparing and submitting your applications. And also to note that there have been some minor revisions to the challenge statements since the version that was released last April. So if you're using an older downloaded version of the RFP, please just make sure you go to our website and download the most recent version. All right, next slide. So what is like the general focus and scope of this RFP? Both of these, the POC and TTS funding opportunities, have a common focus on prevention and promotion of youth mental health. This means that we're looking to fund innovative and context-specific solutions that address the upstream drivers known as the social determinants related to youth mental health. With this, we're shifting from a typical reactive approach to a proactive approach by focusing on innovations that aim to address the social, cultural, I don't know if my sentence got cut off there. We're looking to fund innovations that address social, cultural, and economic drivers of young people's mental health and well-being. We're also looking for innovations that are age and stage appropriate, that highlight and promote the voices of young people, that deliver mental health support through youth-friendly mechanisms, and that can be integrated into existing systems. Again, please refer to the full RFP for the details on what we're looking for, including cross-cutting themes, priority health outcomes, and more. Next slide. So just a quick note on eligibility. In order to be eligible for this RFP, applicant organizations must be legally incorporated, or whatever the local equivalent is, in any country, but implementing their project within one of Being's 12 priority countries. Innovations implementing outside of our priority countries are ineligible for funding. Organizations must also complete all required information in the application, submit through Flux, and submit in English or French. Applications will not be accepted over email. Next slide. So although legally incorporated organizations based in any country are eligible to apply, for example, if your organization is based in Kenya or Uganda, but you're implementing in Tanzania, you are eligible to apply because you'll be implementing in one of our priority countries. However, priority will first be given to organizations based within a Being country, then to those based in other low and middle income countries, and then to those based in high income countries. Priority will also be given to youth-led organizations and projects, and these definitions are included within the application. Next slide. Through this RFP, applications will be accepted on a rolling basis, which means that they'll be accepted and reviewed at specific intake periods until all funding has been allocated. For POC, this is our fourth and final intake period, and the deadline is June 24th. But for transition to scale, applications will continue to be accepted on a rolling basis, with the next intake period ending June 24th as well. All applications involve a two-stage submission and review process. So anyone can submit a stage 1 application, and these questions are used primarily to determine your innovation's eligibility, innovativeness, and alignment with the funding call. And stage 2 is by invitation only. So only those who pass stage 1 will be invited to submit a full application. The application process for proof of concept and TTS vary slightly after the first stage. So again, please look at the RFP for more information on what these processes look like. Next slide. And I'm wrapping up now, but the last point is just on how to register and apply. So all applications must be submitted through Flux, GCC's grants management portal. If this is your first time applying and you don't have an existing Flux account, you will need to register for Flux before you start your application. But if you are reapplying, you don't need a new account. You can log into your existing account and start a new application from there. Once you've created an applicant account with Flux, you can access the application through the welcome tab that you see here on the left, and then you can scroll to find our RFP and hit start a new being application. You can also save your work and return to it by finding it in the drafts, and then once you're done, please don't forget to save and submit. Next slide. So as I've mentioned, all RFP and related supporting documents can be found on our website. We also have a new innovation lookbook where you can explore what we've already funded under this RFP. And then I know most of you submitted questions upon registering for this webinar. A lot of those questions submitted are actually answered within the RFP and FAQ document. However, as I mentioned, if any of your questions are not addressed, please feel free once you've reviewed those to reach out via email at info@being-initiative.org. And that concludes my presentation. Thank you, Natea. Pass it back to you.
Thanks, Erica. And here are some of the contact details. We'll show them at the end as well. And thanks, Erica, for overviewing that process. Let's now go into thinking about what does providing an evidence base for bold ideas look like. So over to Christiane.
Hello, everyone. I'm Christiane Kühnel, and I'm part of the Being Learning and Support Network team at Orygen Global, and so happy to be here with you today. As Natalia pronounced, I am going to give you a very high-level overview of translating evidence into practice in the prevention and early intervention landscape. So hopefully this will provide you with some anchors and assist with your thinking and planning. So I'll start by highlighting some of the useful evidence-based concepts. And this will hopefully help you develop and map your own initiatives within the local prevention and early intervention space that you've got in your country. So here is the first of what we think is a very useful concept, which is a step care model. It's a well-established and efficient way of organizing mental health services and thinking about them to deliver care. It's based on the principle that the level of care should be matched to the intensity and the complexity of a young person's mental health needs. So that a young person, for example, experiencing mild symptoms requires a very different level of care to one experiencing severe mental health conditions. So in this model, children and young people can move between the levels of care based on their progress and change in symptom intensity. So as you will see, hopefully on the slide, there's the various steps, with the first one really being, kind of that universal care provided by family and community support and self-care. Often that's in an app version. The next step is community-based support delivered by non-specialist workers in accessible community locations such as primary health care, clinics, and schools. The next step up are psychological interventions delivered by specialists and non-specialist workers in primary health care, schools, and community mental health centers or teams. And the last step is really that inpatient and outpatient services, which really requires specialists in hospitals and specialist clinics. Mapping your initiatives, I think, within this step care model might help you design your programs within the continuum of care, and not only see where your specific initiative fits, but also to see where the upstream and downstream pathways may need to be constructed around your program so that you can really develop those partnerships so to make sure that young people coming in and out of your program have somewhere to go. Next slide, please. So this next slide has a couple of illustrations. The one on the left, which is the circle, is a model that's going to help you identify those first 2 or 3 steps that we just saw in our ladder. It typically means that you're doing programs in the community, and it's really about enhancing young people's well-being. So with this in mind, I think it's useful to start to define, well, what do we mean by well-being, and how can it be enhanced? So these 2 models are really useful for that. They're conceptual models, and they're available for you to look at and see which one kind of helps you more to develop your initiative. The first one, which is the wheel, is the model of social and emotional well-being. So it really articulates young people's connections to all these domains of their life of wellness, and includes physical, emotional, social, occupational, and spiritual wellness. And it really contextualizes it within historical, political, and social determinants. So in developing your initiatives or thinking about them, you can use this model to identify which domains and determinants are relevant and how they all relate to each other, and where you're going to be working in and wanting to create impact, and how the whole thing puts together. The second model is called let me just find my bearing here. It's the dual continuum model, which looks at the interplay between the stress and well-being, and illustrates how the absence of psychological distress really does not necessarily equate to positive states of well-being, or vice versa. So this is another way you can think about the intervention that you'd like to develop. This model can ask you to consider well-being and the stress, and may provide a more complete picture of mental health, and where your project might fit. So both of these models can really help you identify what impact you want to achieve, and what other conceptual factors you might need to consider. Next slide, please. So again, why focus on well-being? I think from what we've just said, it's kind of obvious, but it's always good to unpack. The concept of well-being really captures, I think, goals that matter to young people, such as functioning well at home or at school or at work, and having good social connections and a sense of purpose and meaning. So just to note that they have different drivers. So sometimes, for example, the drivers of well-being may be different to the drivers of mental health. So the evidence says that, for example, an increase in well-being can lead to a decrease in mental health challenges more than with just prevention and treatment alone. So the evidence is really good to look at there. And also the focus on well-being, it has a fantastic strength-based approach, which really helps to reduce that stigma. Next slide, please. So here are some examples of universal community-based interventions to enhance well-being, just that you can look at. These are concrete examples that you can consider while you're developing your intervention. So the first on the list is positive psychology interventions, which aim to increase positive thoughts, feelings, and behaviors, things like hope, gratitude, and self-compassion. Next is the intervention that increase self-regulation skills, things like goal setting, action planning, managing emotions, cognitive restructuring. Interventions that promote physical activity and exercise, which promote quality of life, resilience, body image, and social skills. Activities in nature and outdoor, which promote health-related quality of life, provide social benefits, and increase self-efficacy. Recreational arts, drama, performing arts, participation in all of these activities can have positive effects on self-confidence and esteem, coping, relationship building, and a sense of belonging. Interventions that improve nutrition, that improve vitality in general and flourishing and motivation. Interventions that help develop social and relationship skills, which really enhance social learning, increase help-seeking, problem-solving, and conflict resolution. Parental interventions, although there's not a lot of evidence here, but there's some evidence that building parental skills and parental involvement enhance youth mental health. And again, back to online interventions, again, here mixed research, but certainly these initiatives are accessible, they're cost-effective, they provide anonymity and confidentiality, which young people really value, and they eliminate access to barriers. Next slide, please. So in this slide, I just want to draw your attention to thinking about the important aspects of the implementation process as you think about your project, which sometimes can get in the way of a really good idea not really coming to fruition. So this is where implementation science can help. And simply defined, implementation science is a scientific study of best methods to take evidence and translate it into practice. And the stages of implementation that are illustrated here in this diagram really can, provide you a roadmap to design and plan your initiatives. So, as you, at the moment that you're kind of considering this funding opportunity, you're probably in the first two stages, which I will go through now. The first one being that you're really exploring, you're identifying a problem or a need, you're assessing the evidence for the program or intervention that could address this problem, you're assessing the fit and feasibility of the program or intervention for your particular setting. The next phase is, preparing. So you're actually now looking internally to see, is your organization ready to implement this program? Do you have a plan? Do you have a team that you can collaboratively work with? And does your team need to have their capacity built, and infrastructure built around that? The stages 3 and 4 are really then, relate to how you're going to implement your model and then sustain it. And, if you were to be successful with this funding, of course, that's you'd get a lot of support from Grand Challenges Canada and our Being Learning and Support Network. So again, now as we go and look at that explore stage that I just spoke about in the first one, we thought we'd be useful to give you some examples of how you might put this evidence-based approach into practice. And our next presenter is going to talk about the evidence in school mental health and well-being.
Hi, everyone. I hope you're well. My name is Zsofia Slamka, and I'm working with Orygen's global team and also on the Being project. My background is in psychology, and I work a lot with questions around evidence and measurement. So today I will be speaking to you a bit about evidence around school-based mental health interventions.
Hello.
So I'm going to share my screen with you so that you can see my slides as well. All right, so we'll speak a bit about the evidence on school-based mental health and well-being. And so as a first question, I guess we can ask ourselves, why think about mental health interventions or programs in a school setting? And so this is a popular field of studies or field of interventions because we know that mental health concerns are so common among students, and they appear indeed early in life. Beyond 24 years of age, 75% of mental health concerns or mental ill health would appear. And so therefore, we think that the early identification of symptoms and receiving support in a school setting can actually reduce the long-term impacts of mental ill health. And so the school setting, it's a place where we can find young people exactly where they are at already. So it sounds like such an easy and immediate way of finding young people and being able to reach them with programs. At Orygen, the last year, we conducted an evidence synthesis and evidence review around school-based mental health programs globally. And so I will tell you a bit about what we found in this review and then what some of the recommendations are that we made that you might find helpful. We looked into different mental health interventions from early intervention through mental health promotion and mental health prevention in diverse settings. And overall, we found that the interventions that are currently being delivered in school settings, they include very different intervention ingredients from things like CBT, cognitive behavioral therapy, through mindfulness programs, or looking at psychoeducation, using art therapy as a source or resource, and then resilience building programs, and so on. What we also found was that the duration of these interventions varied really greatly with an average of around 8 to 12 sessions delivered across 17 weeks on average, but we really saw programs that would be 1 or 2 sessions in a group format to something that would span across the whole school year or even longer. We also saw that the interventions or the programs being delivered would be delivered by very different delivery agents, sometimes teachers themselves, sometimes licensed or trained psychologists, sometimes peers, and then sometimes these programs would have brought in facilitators from outside school settings who might have been mental health professionals, coaches, or someone who they trained specifically for this program and might have come from a research setting. Based on all the evidence that we reviewed, we summarized some of the key recommendations that you could potentially use for a future program. And so first of all, we saw that based on the existing evidence, it makes sense to prioritize mental health promotion in a school setting and or targeted prevention in a school setting. We saw that the evidence is quite robust in terms of increasing mental health literacy, psychoeducation, and support on help-seeking behavior and finding information on where help is available for young people across different settings. And so mental health promotion programs are also quite efficient in decreasing stigma around mental health. Overall, we found really mixed evidence when it comes to prevention. In terms of a prevention program, what does seem to be working is when it's targeted to a group of young people who might have early signs of mental ill health or who might be particularly vulnerable in some ways. We also found that building a tiered system of mental health support in schools makes a lot of sense. Basically, look at the school context as a gatekeeper for the identification of mental health symptoms. And we found that teachers are just as effective in delivering mental health promotion or prevention programs as other delivery agents who might be mental health professionals. But it makes sense to build out referral networks within schools. So think about what is a program that a teacher may be able to deliver and what are program elements that someone who is a trained mental health professional, what is it that they should be delivering? In terms of the duration, this is a tricky one because if you build too short of a program, then what we saw is that there is no long-term effect of the program. And if it's too long, then it's hard to maintain it on the long run. So what we found is that on average, as I said before, between 8 to 12 sessions work probably quite well. And what we saw as a good practice is to introduce booster sessions in a program to ensure that you have that longer term effect. Moving forward, in terms of the intervention ingredients, CBT is very common across different interventions currently being delivered. But in terms of the evidence, what we saw is that actually getting the engagement of young people on the long run is more important. It's a better predicting factor of effectiveness compared to what the actual therapeutic technique is. So just keep that in mind when you think about your intervention. In terms of the delivery agent, as I said, teachers are equally as effective as mental health professionals, but it's important to think about how you can optimize the time of school-based staff. And so what that means is teachers are very often feeling overwhelmed by the different tasks they do already have. So think about building in, for example, admin time for someone who's supporting the intervention. And you can think about using the train-the-trainer model for training school-based staff who might not be mental health professionals themselves. In terms of the evaluation, 2 notes. It's very important to think about what some of the possible harmful effects are of any mental health promotion, prevention, or early intervention program. And think about the cost effectiveness of your program compared to something else being delivered in a school setting. And then lastly, very importantly, across the design of any program, make sure that you co-design it with the potential users and delivery agents of the program. In terms of the school setting, another important thing is that, of course, in any educational setting, you might be working with people of diverse ages, right? You might be working with very young people up to adolescents or even emerging adults. And so a concept that is important to mention here is the developmental staging of mental health programs delivered to young people. And here I just summarize some of the core aspects of that you might want to consider in your own innovation or program. When it comes to children from between 5 to 9 years old, this is where you can focus on their growing ability to build empathy and self-awareness. So this is when you can think about helping them recognize different emotional states, as well as for them to express their needs, feelings, and mental health problems to a safe adult and primary caregivers. This is when also children can start thinking about knowing the different available resources for help and to learn about journeys of support seeking if and when they need support later in life. Then when we think about the age group of 10 to 14-year-olds, this is when it might be a good time to start thinking about the impact of mental ill health, how mental health may differ over time, and start introducing concepts around early warning signs of mental health. And this is where you can establish or elaborate on seeking help and responding to help seeking from a peer. What happens if my friend or if a significant other talks about mental ill health? In a program, this is also a good time to start thinking about self-care strategies and healthy coping mechanisms. And then lastly, when we look into adolescence, and so let's say up to 19 years of age, this is when you can build on all those skills from before, and you can build knowledge and promote self-awareness around mental health and well-being as well. This is when we can start thinking about symptom management and intervention options available, and think about risks and protective factors for mental health across the life course. And then lastly, build self-advocacy skills as well for young people. In terms of where to look for resources, so there's a couple of World Health Organization resources that I would be pointing you towards. And so the first one is the Mental Health Atlas of the WHO, which they release every 3 years. This is a really helpful resource to understand the country context that you're operating in terms of legislation, policies, financing, professionals, or the workforce available in your country. Then secondly, there is already actually a mental health in schools training package built by the WHO's Eastern Mediterranean region. This is free of charge. You can access the manuals online. Moving forward, I would encourage you looking into the World Health Organization and UNICEF program on helping adolescents thrive. Again, the toolkit is freely available online. And then lastly, the What Works centers. These are centers that have closed down 1 year ago, but they built a very good resource platform that is again freely available online, and they have gathered a lot of evidence and resources on well-being. So I very much recommend that you look into that. And so with that, thank you very much for listening, and you will now be listening to the next speaker. So thank you so much.
Great. Thanks, Shafia. Let's move into thinking about, as Shafia sort of mentioned around that the engagement of young people is really important for the success of an intervention. We also know that engaging the community and young people in defining the problem and innovation is also important to the way that you develop your innovation. So a little bit about what community and youth engagement is. It's around recognizing and nurturing the strengths and abilities of community members and young people by providing them with real opportunities to be involved as knowledge sharers, advisors, collaborators, and partners. You might have heard the saying, nothing about us without us. And youth and community engagement is at the core of that. We know that though not all forms of participation are the same quality or depth. So let me talk a little bit about them now. Oh, actually first over to you, Christiane.
Yeah. What I might do is provide some really concrete examples of how you can engage with your community and your young people. I think this is always helpful. So here in the slides is a few lists of things that, have been proven to be effective strategies. So the first one is awareness and education. And some of them overlap with what Jafia just told us about the type of things you can do in school. So awareness and education, helps to debunk myths, educate community members, and includes campaigns, workshops, programs in schools and events. The skill building and empowerment are opportunities really for individuals to develop coping skills, resilience, self-care, and again can include workshops, support groups, and training. Activities around stigma reduction, these really promote open conversations, they improve mental health literacy. It can involve the sharing personal stories and normalizing conversations about mental health, and can really be, have different delivered in different modes like public talks, storytelling events, and hearing the voices of lived experience. Support networks, they create and facilitate development of support networks, and help you reduce the isolation, promote belongings. These can be support groups, helplines, and online communities. Access to services, they can provide information on help navigate pathways. You can advocate for funding and resources and build collaborative platforms. Development of inclusive policies, environments. This really is about advocating for effective policies and practices that support well-being in settings such as schools and workplaces. And lastly, collaboration and partnerships. We really develop shared agendas between mental health professionals, community organizations, government and community members, and really help create that collective impact. The next slides, I will hand back to Natalia, who will talk to us a little bit about youth participations and levels of engagement. Over to you, Natalia.
Thanks, Christiane. So just zooming in on youth participation specifically and thinking about sort of how do we go about doing this? This graphic is based on Hart's ladder of participation, which you may be familiar with. It's thinking about as we go up the ladder, we can see there's an increase in the depth of participation, the impact of participation, and authenticity, where sort of the red points on the ladder are non-participation, levels of non-participation, such as tokenism or decoration, where young people might, for example, be invited to an event to sit on a stage, but perhaps may not have been involved in the planning or in the agenda of the event itself. And moving up to the top of the ladder in green, where we can see the highest levels of participation, where young people are at the core of the decisions being made, as well as initiating the idea. As you would know, in the Being Initiative, that youth participation is really at the core of the initiative, with young people co-owning and being part of the decision-making of the initiative. As we think about the levels of participation, we also have to think about the quality of participation. So how are we setting up this opportunity around participation? One of the models that I like to think about is the P7 model of participation. It really thinks about, on the outside, we're thinking about the context and the culture that the participation activity takes place. What are the views of your culture or your community around involving young people? And how will the resources, for example, contribute to the way that the participation activity or opportunity is designed? And then these 4 gears around the middle really highlight some of the process in terms of engaging with young people. So they include thinking about power relations. So how will you ensure that young people can meaningfully participate, and how will you address the power dynamics that might be at play? Protection and safety. How will you ensure that young people feel safe to provide their input without any impact on their, for example, how people view them in your community? How will you ensure that young people can contribute, and thinking about having young people's inputs valued within the context? And how will you ensure diversity and different perspectives within the activity that you're planning? And really at the heart, it's thinking about, why are you involving young people? Going back to our ladder, is it because you want to tick a box? Or is it because you know that the evidence points to the value and the impact and the effectiveness of having young people within consultations or shared decision-making to be able to improve, develop, or design your innovation? So zooming out a little bit now, back to Christiane around community engagement. Oh, a few more slides from me. So there's a resource here on thinking about how we assess the youth engagement activities that you might be doing and how you might bring in some of these processes within your proposal process. Really thinking about what are you doing in the lead up, how are you engaging during the time, how are you following up, how are you ensuring access as well. And you can sort of ask yourself some of these questions from this resource to be able to ensure that you're always improving the way that you're doing youth participation and community engagement, but also identifying areas where you might want to work on as well.
Thanks, Ataya. So while there are numerous models to guide community, generally community engagement activities, they all have some common elements, and they're really well illustrated, I think, in this slide that I'm going to step through just to take you through. So things like the step one, reflect and strategize. So that's really to clarify the process and goals. What do you want to achieve, and why do you need to engage community? And that kind of echoes back to what Natalia was just saying. Step two is identifying and engaging your stakeholders. So map your stakeholders, those who are affected or those that have a stake in the issue or project and have a real interest and passion for, helping young people in the community. Step three is define the community. So what is the scope of the community you will engage? That really needs to be defined. Collecting data, so looking at data, demographics, needs, existing resources, and you can do that through surveys, workshops, or focus groups. The next step is to clarify community priorities, and that's really, really, really important. You want to work with your community to make sure that what you're honing in on is and then that their preferred avenues of action are really taken into account. Step six is document and communicate. And this is about sharing the process with the community, communicating your plans, and using multiple channels to reach everyone. Step seven is plan implementation strategies. So develop and design your interventions collaboratively with the community and with the young people that you are working with, and really make sure that they address the identified needs. Number 8 is implement effectively. So think about the concepts of implementation science that we were talking about earlier to do that. And step 9 is really to evaluate progress. And it really echoes what Natalia was also saying. It's monitor your progress and evaluate and make adjustments. And back to you.
Great. So let's put it all together. We've talked a little bit about the evidence that's available, some of the foundations around well-being and mental health prevention and promotion. So let's put it all together. Today we have a successful proof of concept innovator, Adi Palguna from Monash, Indonesia, who'll be presenting on his innovation. Over to you, Adi.
All right, thank you, Natalia, for the time. So yeah, my name's Adi, and I'm from Monash University, Indonesia. I'm also a young person and have lived experience with mental disorders as well as suicide attempts. So yeah, maybe let's start with the Indonesia's focus of funding area first, maybe. Natalia, next slide. The previous one, maybe. It's alright. I think it's not there. So yeah, just to give you a background, the focus area of funding in Indonesia is to for being initiative is to invest in innovative solutions that prevent adverse childhood experiences of violence among young people by addressing peer and/or family violence, and promote coping strategies and build resilience to mitigate the mental health impacts of violence among young people. So, as Christiana mentioned before, the first thing that we can do before we, come up with implementation ideas or plan is to explore the issues, like to try to identify the problems on it. What you can do is the first step that you can do is to learn well the big initiative focus area funding in your country. For example, in Indonesia, as I mentioned before, the focus area is to prevent impacts of ACEs on youth mental health. And then try to, as Christian mentioned before, try to access existing projects and even evidence related to your country focus area. And then from that on, you can formulate your ideas in a theory of change. And yeah, maybe next slide. Let's move to the theory of change. So what I did was I identify the focus area in my country, which is Indonesia, which is to reduce mental health impacts of violence among young people. But before I came up with this theory of change, as I mentioned before, I tried to read a lot of literature, research articles via the internet to know to understand existing evidence-based interventions in youth mental health. But as we know, there's still a lack of or maybe disaggregated evidence in low and middle income countries. So what I did was to look for maybe evidence in similar countries, such as in my case, I tried to find evidence in Southeast Asia, such as maybe Thailand or Malaysia, Singapore, as they have more established youth mental health care system. Yeah, and then I just worked towards like kind of backwards. So I try to determine the long-term outcomes. And then as the focus area I mentioned about resilience, so I try to connect that to psychological resilience in youth. And then because it specifically mentioned about reducing peer and family violence, I put that in my theory of change as well. And then from that on, I asked myself, actually with my team as well, like what can improve psychological resilience in young people. Again, I had to consult research articles, and then the general theme that I found that can contribute to psychological resilience is healthy coping skills. And for the violence, we found that psychosocial skills can also contribute to especially emotional regulation and impulse control may reduce violence in young people. And as we know that young people, especially those aged 10 to maybe 17, they're still under their parental care. So it's very important to also involve their parents in the intervention. So that's and to understand the how can we address family violence. From the literature research that I did, I found that positive parenting skills could reduce the events of family violence. Yeah, from that on, I kind of like went backwards again. What can lead to improved healthy coping skills in young people, improve psychosocial skills, positive parenting skills, and then again, I consulted research articles. So I found that mental health literacy, peer support, because we know that young people, they tend to seek informal help before over formal care. So we thought that it's important to incorporate peer support elements in our innovation. And then, of course, to increase psychosocial skills, we need to train young people in, psychosocial skills. Same thing with parenting skills. We need to deliver parenting training to parents. And for the activities, so this is the intervention. So these are just the ideas because to really understand the needs of young people, their parents, and their communities, we need to do a consultation. So what we're going to do is we're going to conduct focus group discussions, or FGD, as well as co-design session, because from doing the FGD session, we can explore young people's mental health needs and their experiences with peer and family violence. And we hope that from the FGD sessions we're going to conduct, we can understand what possible interventions we can deliver and also meet their needs. So as mentioned before in the previous presentation, it's very important to engage young people themselves and their family, maybe caregivers, as well as others stakeholder in their community, so that we know the holistic landscape of their mental health. One of the tools that I use to look for a research article is consensus. Maybe Natalia, you can move to the next slide. I forgot to mention that. So the theory of change is just it's just an example. You don't have to follow it. You should do your own research and adjust your ideas with your country's focus area. And so this tool is called consensus. It's basically it's AI, Gen AI based tool. So before you use it, do understand that this tool can make mistakes, and try to double check at every information that they generate. Basically it's a tool to understand whether a certain intervention is have the potential to deliver the results that we aim. For example, over here, I asked whether coping skills can improve psychological resilience in youth aged 10 to 24 in low and middle income countries. And from 8 papers that the tool consulted, it showed that yes, out of those 8 papers, it says that 88% of them mentioned that it could improve psychological resilience in youth. And then if you scroll down, it will provide you with a list of references that you can read more about. And the best part of this tool is, you can go next, Natalia, is that we can adjust, we can apply some filters. For example, over here, I filter the, so this is to filter the articles that the tool will consult. For example, I chose 2022 as the starting point of articles that I want to consult until 2025. Then you can also exclude preprints, and also you can choose the methods of that the articles use, such as meta-analysis, systematic review, and RCT. So I only chose the top three because those methods are regarded as one of the best ones. And then you can also choose whether you want the consensus to only consult control studies and human studies. And then you can also choose the rating of the journal articles that consensus will consult. And you can also choose the area or field of study that the journals are from, like chemistry. But in our case, I think we should consult domains of maybe psychology and medicine, because most of youth mental health research fall under those domains. And also you can choose specific country if you want. So yeah, that's basically it. Maybe Natalia, do you have some questions maybe about what I just discussed?
I do. Just one question for you, Ari. Do you have just 2 tips for prospective applicants on their proposal?
I think Christian already mentioned about the implementation science stage or something like that. So do use that. And also try to tailor your interventions or ideas to evidence-based, and also make sure that you don't reinvent the wheel, meaning that try to find out if your proposed ideas already exist in your country or other countries or not. Yeah, and then you can maybe, if it doesn't, and if it does in other countries, maybe you can adopt those interventions. So yeah, just try to consult research articles, as well as maybe if you have colleagues in other countries, or maybe in your own countries, you can also consult them as well. So yeah, just reach out for more information and support. Yeah.
Thanks, Ari. That's a good reminder around how evidence supports your idea and innovation, but also how identifying the gaps can also support the definition of the need and problem. All right, so Ari mentioned something which was make sure you first look at the focus areas and challenge statements of your region. And so I'll pass it to Erica to guide us through a bit of an update from the GCC team around addressing the current innovation gaps.
Thanks so much, Natea. Britt, are you on the line, and would you like to start?
Yes. Hi, everyone. Good afternoon. Good morning. Can you all hear me? Great. Mostly we want to spend some time on Q&A today, so I'll keep this brief. But my name's Brittany. I'm one of the 3 portfolio managers on the Being mental health program here at Grand Challenges Canada, and I'm specifically responsible for overseeing the Sub-Saharan Africa cluster of countries for the Being Initiative, which, as many of you know, is Tanzania, Senegal, Sierra Leone, and Ghana. And you'll hear from my colleagues Sahil and Sarisha as well over these next few minutes. And one of the things I just wanted to point out is that a few of the speakers today have touched on some of the things that we've been grappling with, actually. So, Sophia, thanks for the great presentation about the importance of targeted interventions, targeted promotion and prevention interventions in school settings, especially, I think, in Tanzania, where the focus is on stigma reduction and addressing stigma around mental health. We've seen really broad programs come in and applications that don't necessarily address a specific underserved group of young people that may be particularly at risk of experiencing stigma. around mental health. So that was a helpful point to just reflag again now. We've had so many applications come through Tanzania. I think they're the highest volume for the Sub-Saharan Africa cluster come through Tanzania. But you know, things kind of start to look the same over and over again. You know, a school-based awareness raising program about mental health literacy that's really broad and not necessarily targeted. So, you know, making sure that those initiatives are a little bit more targeted can help set your application out from other applicants. In Ghana, where we've recently revised the challenge statement, where it was previously really focused on addressing bullying in schools, and it's been broadened in this round of the RFP to address mental health in schools a little bit more broadly, with a focus on bullying prevention, which was identified through the stakeholder consultations as a big challenge in Ghana. We have seen, for example, lots of innovations and applications that address the importance of like reporting bullying incidents, but it's not necessarily linked clearly in like a theory of change style explanation why that's really important. And Adi, you did such a great example of kind of showing your theory of change and mapping out what specific outputs and actions and activities might lead to the country priority being improved. So I would say in Ghana, you know, it's kind of linking how reporting bullying incidents is really evidence-based, or why that's an important component of addressing bullying, but it's not the only factor, and sometimes it's the one thing that applicants are kind of identifying as like particularly innovative. So there's got to be other components that it's sort of part of and linking to how the challenge is being addressed. Those are two things I really wanted to highlight from our cluster. And I want to keep a lot of time for Q&A because there are lots of questions in the chat that I think we haven't yet had a chance to answer as a team, because there are many. So I'll pass it over to Sarisha to speak next.
Thanks so much, Britt. I'm just going to share my screen here and get started on the Latin American and Southeast Asian aspect. So I'm Sarisha. I am one of the 3 portfolio managers that, as Britt had mentioned, at Grand Challenges Canada. So I'll be talking about Latin America, Southeast Asia, countries that are funded under the Being Initiative. One main aspect to note is that the original challenge statements have been included in our Appendix A of the RFP for these countries still have the same focus, but they have been adapted to be a bit more broader in scope. So for instance, in Colombia, we're still focusing on improving family functioning by addressing conflict and/or violence for young people. However, your solutions can involve whatever aspects that you envision or have tested will have a positive impact on youth mental health in Colombia. So I'd like to highlight that proposals must also include all target populations as identified in the RFP in Appendix A. So for Colombia, for example, that involves not only including young people aged 10 to 24, but also their parents and caregivers. In Ecuador, the focus is a little bit different. We are continuing to focus on promoting the physical and emotional safety of young people in community, school, or family environments, with a focus on preventing violence against young people. I just want to make sure that you can see my screen here. Okay, I know I've been talking. Okay, awesome. Thanks, Natalia. But our target populations for Ecuador are similar to Colombia, with a focus on young people, their parents and caregivers, with the option of also including teachers or other school staff. Let's see if I can go to the next slide. So Southeast Asia. In Southeast Asia, we're focusing on Indonesia and Vietnam. So in Indonesia, we're focusing on adverse childhood experiences among young people, with a focus on peer and/or family violence. But our target populations are similar to Colombia with young people and involving their parents and caregivers. And finally, in Vietnam, we're focusing on strengthening family functioning by addressing strict parenting styles and family conflict or violence for young people. And the target populations, again, are similar with young people and a focus on parents or caregivers. So my final slide is some of the shortcomings that we're seeing, or some of the negative aspects that we're seeing for some of the applications that are coming through for these particular countries. Now, these challenges are listed here for you to keep in mind so that your applications can avoid these aspects. So I'm seeing a lot of multi-component interventions that are being proposed that are unfocused with too many aspects or components. And it's typically unclear how all of these components are related or how they work together to positively influence mental health. So just want to highlight here that it's very important to focus on the aspects that directly relate to the challenge statements and that will influence positive mental health for young people by the end of the project. Second, the bold or innovative aspects are not always well highlighted, and it's sometimes unclear if and why a proposal is innovative in a specific country or context. So this really needs to be highlighted, and it needs to be upfront and well explained for the particular country you're focusing on. Now, the mental health outcomes of the intervention are not always well highlighted, and the pathway to impact is not always well described in the application. So basically, we're talking about how proposals lead to improved mental health outcomes for young people. And I know Adi got into this a little bit, but it may be helpful to talk about a theory of change or how you connect the dots from implementation of the intervention to the final outcomes, which are the mental health outcomes that we'd like to see. In some cases, there is a heavy focus on treatment, and there's little focus on prevention and promotion of youth mental health. And of course, as you all know, the focus of this RFP is on prevention and promotion of mental health. So all applications should mainly focus on these aspects. I've also seen that certain target populations, such as parents and caregivers or educators, are excluded from interventions, or there is very limited involvement of these groups. I would just want to highlight that all applications must involve the target populations that are identified in Appendix A for each of the countries. And then finally, I'd like to end with some country-specific reflections for both Indonesia and Ecuador. Now, in Indonesia, we're seeing very limited, innovative, or bold projects that are being proposed. Many are seem to be unfocused with multi-component aspects. So for us, it's really important to highlight why the proposed intervention is bold or innovative for Indonesia by highlighting what is currently being done to address adverse childhood experiences and how the intervention might fill a gap. The proposed interventions should be more focused and or thoughtful with the components that are being included. And finally, in Ecuador, the link to physical and emotional safety is not always clear in proposals, and thus the relevance of certain interventions to the focus area is definitely, it's not at the forefront. So it's important to highlight the safety aspects of the proposed intervention and how the intervention will improve physical or emotional safety in community, school, or family environments, and how this will lead to improved mental health outcomes. So that's it for me in terms of Latin America and Southeast Asia. I'll pass it over to Sahil.
Thanks, Risha. Thanks, Brett. Hello, everyone. Good evening, good morning. So I'm the last speaker, so just bear with me for 2-3 more minutes, and then we will open for questions and answers. So I'll focus on 4 countries: Morocco, India, Pakistan, and Romania. To begin with, those who representing Morocco, so please note that we have revised our challenge statement. So now the challenge statement, earlier it was focused on safe spaces, but it is now more general in nature. So we have been looking for innovations in school-based settings. But important thing to notice, like we are not looking to fund anything which are standalone interventions, which mean that which are not rooted in school environments. And we are also not looking at innovations that do not engage with school systems directly. So those are like two important considerations when you apply for Morocco. For India, the priority areas remains the same, family functioning. So we are open to what digital solutions with strong engagement of parents and young people. We are particularly interested in community-based solutions, especially that leverage task sharing models, wherein we utilize primary healthcare systems to involve parents. We've been also actively seeking private sector involvement, especially for-profit organizations for our innovations. But what we do not fund, or what we may not fund just because we have funded them before, is first that solutions which lack community integrations. For instance, like if solution is largely focused only on school settings, so that solution may not be prioritized. The other one is that solutions that are focused on peer-based approaches. I think we've already funded them, and so we may not look towards peer-based approaches in this funding call right now. And then the approaches that do not clearly demonstrate impact on youth mental well-being. For Pakistan, we have been focusing on community-based approaches. We would love to see if we could also involve existing community structures or informal networks in our solutions. But what we would not fund as a workshop-based models or one-off training sessions. We may not look for the capacity building only approaches. For instance, like if you just focus only on building capacities of parents or young people is something that we've already seen before, and especially on the task training models too. So we may not look for the task training models for Pakistan. In Romania, our focus is largely again on addressing bullying and cyberbullying amongst adolescents. We are open towards digital innovations, especially those that can integrate AI or intelligent user support. We are actively looking at solutions that involve caregivers or parents in Romania because they have been seen as an active stakeholders in the interventions. But what we may not fund is anything which is in relation to digital games or gamification or game-based interventions. And then we may not also fund like anything which is related to peer-led workshop models, which we have already explored in our previous rounds. So with this, I'll pause here and then over to you, Nita.
Thanks, Sahil. Actually, over to Catalina from the
Okay.
Eastern Europe, our regional hub.
Hi, everyone. Nice to see you all here. I'm Catalina. I'm the Eastern European Hub Coordinator. And now it's the time to start with the Q&A session. We have lots of questions, and thanks so much for asking. Some of them were already answered in the chat, so maybe you could look in the chat and see if there are some questions that were addressed there by our colleagues from GCC. We also have some questions from the registration form. Some of you have asked there some questions, so I will start with one question that is addressed to GCC. Related to the project scope and focus, are there particular types of interventions encouraged?
Yeah, thanks so much, Catalina, and thanks for this question. I guess I'd reiterate here that the scope and focus that we're looking for with each type of funding opportunity are included in the RFP. But the main point, I think, the couple main considerations are that we're really looking for those prevention and promotion approaches that address youth mental health and well-being that are aligned with the specific area of focus within each country. For things like funding amount and duration, cross-cutting themes, all of those are included within the RFP. And then I guess just for TTS, for transition to scale, I want to reiterate, we get this question quite a bit, that this opportunity is for organizations who they themselves have already tested and established proof of concept for their innovations. We see a lot of proposals which are just citing other resources or other evidence that exists, but we're looking for those organizations that transition to scale who have already tested their innovation. So that would be, again, the main reminder, prevention and promotion aligned with those country areas of focus.
Great. Thank
And
you.
maybe I'll just,
Brittany?
I'll just add one thing. Thank you so much, Catalina and Erica and everyone. One thing I want to flag that we have available now online that we didn't have yet in previous rounds are the country pages on the Being website, where you can see what's being funded already in each of the 12 priority countries. And I encourage you to take a look there before you craft your application or submit it. It's April 22nd. There's more than 2 months, I guess, until the application window is going to close, the next window. We're adding more innovations all the time to the website as new initiatives are being supported and signed. So, consider taking a look at what's being funded in your country already and how what you're proposing might be different or complementary, and not more of the same in your country, because we're looking to fund, a complementary, diverse portfolio of initiatives. And there was a great question in the chat earlier about whether we're looking for more targeted initiatives than broad prevention programs. Not necessarily across the board, but for example, in Tanzania, where we've seen a lot of broad-based prevention programs, if somebody's proposing an innovative, bold approach to supporting stigma around mental health for a particularly underserved group of young people, that would be interesting and complementary to the existing, sub portfolio of initiatives funded in Tanzania so far. So I just wanted to say, consult what's going on in your country and being funded in your country through Being already, and how your work might connect or complement some of that.
Great. Thanks so much, Brittany and Erica. The second question I have selected from the registration form is actually related with some questions I've seen in the chat during the meeting, and is related with the consortium. How does GCC view collaborations and partnerships related to their proposals? Consortiums versus individual implementing organizations.
Yeah, thank you so much. I think, the short answer is that, collaborations are welcome in your projects, whatever that looks like for you. However, when you're applying for this funding RFP, you can't actually, submit a consortium application. There's always going to be one lead applicant that is submitting and creating the application. That will be the organization that is going to undergo the granting, with Grand Challenges Canada, and be ultimately responsible, for the implementation of the project. So you can collaborate with other organizations, but those will be structured more as sub-grantees or subcontractors. So yes, collaborations, partnerships are welcome, but you can't actually submit an application on behalf of 2 organizations or contract with 2 organizations directly. So I hope that answers your question. If you have a really specific use case, please do feel free to reach out to our email. But yes, thank you. And maybe I'll just jump in here as well, because I'm seeing lots of questions in the chat about, I'm based here, but I'm implementing here. Am I eligible to apply? I just want to reiterate again, organizations incorporated in any country are welcome to submit an application as long as they're implementing within the 12 Being countries. So if your organization is incorporated in France or Canada, Uganda, Zimbabwe, you're all eligible to apply as long as your project is being implemented within one of Being's 12 countries. And then again, just note that we're going to prioritize those which are based within the 12 Being countries or other LMICs, to promote localization and supporting those local ecosystems. But again, all of that's within the RFP and FAQ. I just wanted to raise that because I've seen that question pop up a lot in the chat, and I hope that answers your question.
Thanks, Erica. And some other questions I've seen in the chat were related to the flexibility in approach, and if there is any flexibility in the innovation eligibility. So for example, can they use mixed methods, in-person and tech-based, for proof of concept, or is there a preferred delivery mode? And if you are open to AI-driven solutions for the proof of concept. who would like to answer the questions?
Perhaps I can just jump in here really quickly, and others, please feel free to add. But in terms of the methodology that you're using, that's really up to you. What we would love to see are the quantitative measures that show improved mental health outcomes for your proof of concept. Now, that also speaks to our transition to scale as well. You know, we do want to see proof of concept with improvements in quantitative aspects. That's not to say that qualitative is not important. Of course, qualitative information is great to provide as supporting results for transition to scale projects. And the other aspects, Catalina, that you highlighted was
Yes, were the AI-driven solutions. And
yes, I think we're also open to, you know, innovation in and of itself. So if you think that whatever solution you're providing is innovative within the country of focus, then we welcome you to develop your applications based on that solution. So, you know, of course, you heard from each of our portfolio managers. There are certain types of projects that we may not fund because we've already funded projects of that type. And so I don't think AI has come up in when our portfolio managers have spoken, but we do welcome anything that's innovative or bold within your country of focus. So feel free to include those aspects in your application.
thank you so much, Sirisha. If anyone from GCC wants to add anything else, if not, I think it's time to wrap up, and
Yeah.
I'll pass. Yes.
I can add, Catalina, just because there was a question in the chat from Ajay Kara about if an innovation has been proven in one context, but they want to test it in another context, would it count as TTS or POC to transition to scale or proof of concept? This is a great question. We've been navigating this throughout the last, you know, 6 months or so of reviewing applications. And it kind of depends. I think Sahil answered this question in the chat, my colleague. But I just wanted to elaborate that if an innovation has proven some psychosocial well-being outcomes in another geography or country, but not necessarily on the specific country priority outcomes that we're looking for the Being Initiative. So for example, if you've got some well-being data about a program that positively influences young people's well-being, but not necessarily demonstrating an impact on stigma reduction, which is the specific country priority for Tanzania and Senegal, for example, then it would be then, you know, you can go to transition to scale because there's some robust evidence already of some impacts on young people's mental health and well-being, but the transition to scale investment would be phased likely at what we call a transition to scale 1, which is the way that GCC takes like a phased approach to investing at the transition to scale stage, so that the first year or 18 months can be focused on just testing whether the intervention has an impact on the specific country priorities that have been addressed under the Being Initiative. This is a little bit nuanced here, but if there's already some robust evidence that an innovation is having a positive impact on well-being, you can likely advance to the transition to scale program. However, if there's no evidence yet at all, and you're testing like an intervention for the first time to see that it has any impact on positive mental health and psychosocial outcomes, then you will want to apply for the proof of concept funding stream. I hope that's a helpful distinction.
Thanks so much, Brittany. And I think it's time to wrap it up. Before doing that, I would like to share with you all our evaluation form. We would really appreciate it if you would fill it out and let us know if there's anything we should improve for our next webinars. And now pass it over to Natalia. Thanks, everyone.
Thanks, Catalina, and thanks everyone for the robust session with many questions. As Catalina mentioned, please fill in the evaluation form. It's great to get your feedback, and we will compile the questions. We also have compiled all the resources from today's workshop into a handout. And we will distribute that, as well as Eric has mentioned. The recording as well as the slides will be available on the Being website after this session. As we mentioned, if you have any additional questions related to your case or your proposal, please contact the email here. As well as please read through the documents related to the RFP opportunity online, as well as your first go-to point. And as we mentioned, all of the extra links related to this call will be online as well. So thank you all for coming. We can still see that there's lots of questions through, and we'll try to ensure that those questions are captured and the responses are captured as well. So thanks everyone, and have a good rest of the day. See ya.